Welcome to the Confidence Through Health podcast, episode 180. And I talk with Anna and Vivian. They are launching the Pain Project podcast, and they are on, Apple Podcast, Spotify, YouTube. But I've known Anna for several years, and she let me in on her own journey of chronic pain several years ago. And I've been there to support her in several different conversations. But as she launched this and I found out about it, I wanted to have her and her daughter on, who they both have dealt with chronic pain for a very long time. They tell their story. And it's not an episode where we're trying to fix chronic pain. It's an episode where I wanted to make sure that people out there that are dealing with chronic pain know that, one, it's okay. And know that, two, here's what you can do. And for the people that are not dealing with chronic pain, that, like myself, I don't deal with chronic pain. I know people that do. What do they need from me? How can I help? What can I do to help them get through their day-to-day life? Because I know I can't fix it. And there's some of these issues, some of these chronic pain issues are not fixable. They're manageable, and we talk about that. And so I think it's a great episode. Please share it with people that you know are dealing with these issues, because these two ladies are passionate about what they do. They want to help people, and they want to normalize the conversations around chronic pain and having people find ways to get help so that they can manage their daily life just a little bit better. So I want to thank you, Anna and Vivian, for being guests on the Confidence Through Health podcast.
Thank you. We're glad to be here.
So y'all launched something recently called the Pain Project. And Anna, you and I have been friends for a while. And when I saw this, I was like, I need to have you on. My wife actually said, you need to have her on to talk about this, because we know a lot of people that deal with chronic pain. And so we want to get the word out for you, but also just to help people understand, like, maybe they are dealing with something and they don't even realize it, right? Because they've just bucked up and dealt with it every day, just because, like, that's what society says, get up and do what you have to do and don't complain. And so tell us a little bit about where the Pain Project came from.
Yeah. So first, apologies for my voice.
No worries.
But we'll just keep going. So we started the Pain Project together because this is something that we've been talking about basically my entire life since I was 2 years old. I've dealt with chronic pain, and I was diagnosed with juvenile arthritis when I was 2. Mm-hmm. And that that set us on a path. I think, right. You dealt with some stuff prior to that, but it wasn't necessarily, I don't know that you addressed it as much at the time, but that kind of was what set us on a trajectory of getting into the medical world, talking with doctors, trying to figure out how to advocate for, she's my mom, so she had to advocate for me as a child, and getting, very familiar with doctors and then not just the medical world, but also the just society and what society says about pain, and like all the different things that maybe you should try or maybe you shouldn't do or whatever to make you feel better. And so we've been talking about chronic pain for my entire life.
Yeah.
And
So, and for me, obviously being her mom and advocating for her whole childhood from 2 to 18, when she took over her health care for herself, I dealt with infertility and what I just call female pain,
right?
Due to infertility issues, endometriosis and things like that, chronic pain. But again, back then, 30 years ago wasn't talked about.
Yeah.
And even going to the doctor and saying, I'm in pain, he's like, you're 25 years old. You shouldn't be in pain.
Right.
We just need to get you pregnant. Okay. And so
right.
conversations with doctors, and even with her, juvenile arthritis is an autoimmune disease. Mm-hmm. So, and those who are familiar or not familiar, autoimmune is when your body's fighting against itself.
Right.
So in the journey of trying to figure that out, it's like, why?
Yeah.
Why is her body fighting against herself? And of course, I don't even think that there's a full answer to that to this day.
Yeah.
So yes, that journey of together when she was little to figure out how to walk through pain. She was a little girl with knees that were size of softballs.
Yeah.
And she was little. She's a tiny little thing, but her knees were the size of baseballs, and she walked very stiff.
Mm-hmm.
And couldn't bend her knees, couldn't run. There were times that it was so bad that she would army crawl. Did she know she was in pain? Was she miserable? She really wasn't. She's a pleasant, beautiful child.
Right.
But her dad and I are looking at her going, oh my gosh, this is
right.
This is brutal. And we know it's painful for her. Anyway, that really is what started the journey. What added to the journey then is 15 years ago when I was diagnosed with fibromyalgia, depression. I have degenerative disc disease now. That's kind of the newest thing for me. Even though I had it years ago, it just got overlooked. But again, and I keep saying that because part of the conversation with us now is, why did I fall through the cracks?
Right.
That wasn't dealt with, or why was I too young to be experiencing chronic pain, or why was she too young to be having arthritis? Mm-hmm. And then now why am I? It's just because I'm old now, and that's why I have degenerative disc disease.
Right.
I was never the right age to experience what I was experiencing.
Right.
So
yeah.
We are the point of the pain project is we want to normalize talking about chronic pain. We are normal people living normal lives, for the most part, normal. But we get up every day with that reality. We have pain. This morning, I'm like, I don't know if I can do this today. I hurt so bad.
Yeah.
I hurt so bad, and I'm so tired. And she's been sick, she's lost her voice. Her baby's sick. There's so many things, and that's just normal life. You add pain to that, like body pain, back pain, neck pain, feet pain, whatever. For us, it's almost everywhere.
Yeah.
We want to normalize talking about it.
Yeah.
Yeah. Yeah. A big part of it is, a lot of times the conversation surrounding pain is, how do you get out of it?
Right.
Okay, what medicine do you need to take? What food do you need to adjust? What exercise regimen do you need to do to get out of pain? And that's completely valid and legitimate for a lot of situations and a lot of people. But there is a demographic of people that deal with chronic pain. And our reality is that we likely will never be out of pain.
Right.
It's not our goal necessarily to get out of pain. It's, how do we live with pain?
Right.
How do we define living and thriving and survival and all of those things while daily being in pain and knowing that there might not be an end to it.
Right.
So,
well, and that's, one of the things that I'm sure that y'all have dealt with you mentioned this with the doctors a little bit, and my wife had endometriosis, and we went through infertility, and we went through, she had pain on a regular basis. But everybody has their opinion, right? Because we heard the same thing you said, is that like, you just need to get pregnant and it'll solve everything. Right. And it's like, everybody has their opinion on how to deal with it. And sometimes that might work. or it might be a temporary fix because it's like, okay, it takes the pain down from an 8 to a 6. But like you said, it's not something that it's going to go away and be a 0 for the rest of your life. Like you may get lucky and wake up and it's a 3 one day, but knowing that in all likelihood, okay, that 6, 7, 8 is coming tomorrow.
Especially if it was a 3, because when it's a 3, we're like, ooh, we can get a lot done today.
Right.
And then we pay for it the next day.
Right.
So anyway, yes, that is very true, Jerry. Very true. Yeah.
And so when somebody's looking for, if they say, okay, well, maybe I am, like they're listening to this or they find you through your podcast and, okay, maybe I am dealing with chronic pain and it's not just in my head. It's not just something that I just can't figure out life compared to everybody else who appears to be having perfect life. Like, where do they go for help? Because like you said, a lot of doctors, especially if they're not in the right age demographic, are going to look at you and go, well, I don't know what's wrong.
Yeah. Yeah. They also say, but you look fine. You look well. Your blood work good. So and that is all true. Usually blood work is great. Usually you in appearance look fine, but your body is just falling apart. So where do they go? Or what do they do? The first thing, and this is so hard. This is a really hard question.
Yeah.
If we had one question, we wanted to avoid one, because there isn't an answer.
Right.
But my recommendation is first find a team of people who will stand by you. And I think you have to ask specifically for that.
Yeah.
And I'm just learning that right now. Because I've not had a team of people that were on my side helping me. But I also didn't know how to ask. So ask for your team, and your team can be your spouse, your significant other. Hey, your best friend. Hey, I know you don't understand what I'm going through, but I need you to help me with these things. Encouragement, support. Will you go to the doctor with me? So that way I don't get all fumbled up with my words when I'm at the doctor. Tell your doctor, even the doctor who said, I don't know what's wrong with you. Say, well, I need a team member in my life that's medical that I can come to and go, what is this?
Yeah.
Why am I, okay, you're saying I have fibromyalgia, or you're saying I have lupus, or name the invisible illness, if you will.
Right. Yeah.
I need help with this because I'm going to get another symptom and I'm not going to know what to do. And I think that idea of telling your doctor, I don't expect for you to fix me, but I do need someone medical on my team.
Right.
Yeah.
Yeah.
And I, again, just now learning this after all of these years.
Yeah, I think so. In dealing with doctors, a lot of times, so they'll walk in the room and it's their job to fix the problem.
Right.
And when you come across a person that's dealing with a chronic condition, there's not much that you can do outside of managing symptoms, which there are different, there's different chronic illnesses that definitely need different types of symptom management.
Right.
Crohn's and, digestive stuff, arthritis. There's a lot of different kinds of things that do need very specific symptom management. But I've noticed that it can be very, very difficult for a doctor to look at a person and say, I can't, there's nothing to do. So I'm sorry.
Right.
And then a lot of times that leads to the patient getting written off because there's no really straightforward answer. Like for me, any medication I ever have been on, I get the weirdest side effects.
Yeah.
I get the random side effect that they're like, that never happens.
Yeah.
And so my doctors have always been like, what do we do?
Yeah.
We've tried everything and it's really weird. So just being able to have a doctor that you can talk to and say, look, I understand that you want to fix me. I'd love to be fixed. But can we be on the same team? Can you be on my team?
Yeah.
And work with me, and being able to have a heart to heart with that doctor. And if that doctor does not soften and say, yes, I am on your team, we're going to figure this out together, then I recommend finding a new practitioner.
Right.
And doctor shopping is the worst. It's so hard to find a doctor, and getting second opinions is really hard. But I would say to the person who is trying to figure this out, you are worth the effort of finding a doctor that will be on your team.
Yeah.
So if you are, if someone is dealing with chronic pain and they are exhausted from trying out doctors, this is why you need your other people on your team.
Yeah.
It's why you need your friends or your spouse or your partner or whoever it is.
Yeah. If you a therapist, chiropractor,
I don't care who it is.
it doesn't matter. It doesn't matter.
You need somebody who can be around you and help you up.
Yeah.
When you're feeling down. I mean, to have somebody to come with you to a doctor's appointment to take notes or to record the conversation or to say, now hang on, you said, you said you were dealing with this. Let's address that too.
Right.
Just an outside perspective is so helpful, because in your head, in the moment, it can get so clouded, and
you trust that the medical professional is going to answer the questions and give you exactly what you need.
Right.
And this is not a medical professional bash session at all.
No, not at all.
We have high respect for our medical professionals that are in our life and that have helped us along the way. And we actually have a lot of compassion for them, because we realize when we walk in their door, especially with me, they're not going to know what to do with me.
Yeah.
They don't know what they're walking into.
And,
right.
and I've learned to not have all these expectations on them, but be like, okay, look, don't freak out.
Right.
You're not even going to have to write a script for me, because I can't take drugs. So I just have a new symptom, and this is what I do. Yeah. Here's my new symptom. So doctors don't always know what to do if they can't write a script.
Yeah.
And they don't have the time. They're not allowed the time.
Right.
Because of insurance or because of whatever. So we've tried really hard in our lifetime to have patience with the doctors that we go to. But again, that learning to ask them, hey, will you be on my team? Because I'm navigating this and I don't know what to do. Right. And I don't know where to go next. I do recommend.
Go ahead.
Go ahead.
Well, I was just going to say, I think trust is the big piece there, right? Like,
oh my gosh.
Because as you said, Vivian, and when you said it, I automatically popped into my head an article I read last year that, and I can't remember the exact percentage, but I know it was over 50% of second opinions are a different diagnosis. And so it's like, okay, well, if you don't trust this doctor, you go to another one and you get was the first one correct, or was it the second one, or is it both? Like, if you're dealing with chronic issues, the symptoms for different things can overlap. Right. And so one doctor reads something one way and another doctor reads it another way. And like you said, if the blood tests are normal, then, what's your latest symptom is what they're going to go off of. And so that trust factor is huge, in not just you coming to an understanding of like, okay, I can deal with this, whatever the professional is saying, but also from their side of it, that like, okay, I believe in you, and I trust that you're going to stand here and help me navigate this, like you said, but not just come in and say like, oh, if I can't fix you today, then I'm just going to have to leave.
Right. Yeah, exactly.
And can I give a little example of?
Yeah, go ahead.
What happened to me once. It was a functional medicine doctor, and I did the whole team approach with his office, and it was a great experience. This was several years ago, and I came back into his office after several weeks of doing all the things that he recommended that I do, changing my diet,
Right.
PT, physical therapy, I don't even remember. There was just a ton of things.
Yeah.
I changed it all. I did it all. It was several months. I went back in his office and he goes, "Are you feeling better?" And I said, "No, no. In fact, physical therapy was brutal."
Oh, I'm sure.
It takes me days and weeks to recover from one appointment.
Yeah.
And so we kind of talked a little bit, and he had a pen in his hand and he's just sitting there nodding his head. And I'm frustrated.
Mm-hmm.
And because I was feeling at that moment a little hopeful,
right,
that maybe we were going to get somewhere. And so when I said that PT didn't work and that I don't feel any better, that my body's still hurting, my legs still feel like they weigh 150 pounds apiece. And he took a pen and he threw it across the room, angry.
Yeah.
And I was like, "Why are you mad?" And I never went back.
Yeah.
I was like, that trust, that if I had any trust, was completely gone.
Right.
Was he frustrated? Absolutely. Mm-hmm. I'm a frustrating case, and I'm not going to lie about that. And I felt for him, but his acting out in front of me made me not trust him with any part of me.
Right.
And I felt bad for him. And of course, I kind of just went on with my life. I don't even think I found another doctor.
Yeah.
Because that was this wasn't a great experience.
It's crazy.
Yeah.
I didn't know that.
Yeah.
Well, but that just shows the point of like, in what you're describing as far as people on your team, whether medical professionals or clergy or best friends or whoever, is it's the old scenario of, when somebody comes home from work, the spouse comes home from work and they've got something that they need to talk about from the day, and they start talking about it, and like the other person needs to quickly go, "Okay, wait a minute. Do you need me to fix this situation? Or are you just telling me what happened?" And it's like, that's the team member you need, is like, tell me what happened. Let me soak it all in. Let me understand and have empathy for you. But you're not expecting me to come with a solution. This is just another step on the journey of like, we're figuring out the puzzle, and we're 10 pieces into a 20,000 piece puzzle. Right. Like, we got a long
That's
way to go.
Probably when you're done going to be missing a piece.
Right.
Yeah. It's not ever going to be completely done, and that's going to be frustrating. So, yeah.
And that's a big part of why we wanted to start this whole thing.
Yeah.
Is because we know what it's like to not have a team. We know what it's like to feel like we can't share our stories with people. And so we were like, I don't know, there was some light bulb moments and a series of events. And we were just like, oh, this is something that's really needed in this community, is a safe place to be able to tell your story. And I mean, education about advocating for yourself, and, teaching loved ones how to advocate for their person with chronic pain.
Right.
And then also to engage in conversations with doctors and with medical professionals and with spiritual leaders, so that we can do whatever we can to fill these gaps, so that people stop falling through.
Right.
And so that, because a lot of times people with chronic pain, they will fall through the cracks. They will feel alone, or, you start to, someone says, "Hey, how are you doing?" Just, a friend or something will say, "How's it going?" And you're like, "Do you want to know?"
Right.
How do you want me to answer this question exactly?
Yeah.
And so then you open up and you share, and then you realize, oh, they weren't ready for that.
Yeah.
They weren't ready to hear all of that. And so now I have opened myself up to a place that wasn't safe.
Mm-hmm.
And now I'm just not going to do that anymore. I'm not going to share my story anymore. And that happens enough times. And you feel like your story and your struggles and all those things are not worth being heard by people. And so, and whether it's, not worth being heard by doctors or friends or spiritual leaders or whatever the case, or even if you're silencing yourself, because I know that that's something that we've done too.
Right.
Is I just have to push through. I just have to get through the day. And you do that enough, you end up silencing yourself and not listening to your own body.
Yeah.
And you'll hear us say a lot, with the Pain Project, we want to show up for other people, but we're also going to be showing up for ourselves.
Right.
Because for me, this is something I have not done ever until now. And it's an interesting project to show up for yourself.
Yeah.
So, and Vivian has said several times, sometimes we fall through the cracks with medical professionals, spiritual leaders, our social life. It's like everyone's going out and having a grand time. And it's like, well, I can't go out because I worked all day, or I'm just exhausted because of the chronic pain issue. We want to be a soft pillow people can land in when they fall through that crack. Right. And then hopefully maybe educate and help encourage the spiritual leader, the medical professional, and the loved ones to help people not fall through the cracks.
Right.
We both have had experiences in the church world, and I hate. Okay, we've had experiences in the church world that Christians want you to be healed.
Right.
Period. We want to experience the healing power of God. Right. I hope it's the day that I say that in this setting.
Yep.
And that's a noble thing. It is an absolute, we talk about it every day. If God chooses to heal, we are in for it.
Right.
We are all in. But God doesn't always heal.
Yeah.
So if people are saying, Vivian, I'm praying for you. I'm trusting God to heal you. Anna, I'm praying for you. I'm trusting God to heal you. Okay, thank you. But what about now?
Right.
What about getting through the day? What if God doesn't heal me? Well, then you don't have enough faith. Is where that comment, you don't have enough faith. And it's like, well, no, I totally have faith, but I have to live in reality.
Right.
To live right now.
Now, I don't feel good. Yeah. And I have to believe God is right here with me, not over there somewhere waiting for me to pray the next prayer, to do the next thing so that I can be healed.
Yeah.
Right.
If I just go to church, then that might be the day I get healed. Well, God isn't just at church. I had to learn about 15 years ago that God was when I was laying in bed, he was right there. Mm-hmm. His presence was near me, and I didn't have to go anywhere to find him. Yeah. He found me.
Right.
So, and there's that crack with the spiritual leaders and church.
No, and I agree with you on that there is a segment of people that will push that way, push that direction. And I imagine, of course, it makes you feel horrible. It can very easily, and in all of these things can, and I can easily see where if you don't have a strong team of people to go back to and go like, oh my gosh, this person today was da-da-da. Can I just, that getting stuck in your own head and going down into a depressive hole can be very strong reality.
Absolutely. Regular, on a regular basis. Yeah, for sure.
Yeah.
Yeah. And we say this a lot in our conversations with each other. A lot of times the problems are very similar in medical worlds or spiritual worlds. Mm-hmm. It's slightly different, but people will, so if people are asking and saying, hey, I'm praying for you to be healed. And that's great. But the question is, okay, but can you be with me and do life with me and live with me and all of that? What are you going to do if I'm not healed? And what is a doctor going to do if medicine doesn't work?
Right.
It's that daily living.
Yeah.
And not just looking forward constantly of saying, okay, when I'm better, then I'll be able to do this. How can we live our lives in a contented and hopefully happy way? The way that we are right now.
Right.
Instead of just constantly hoping and grasping for something that may or may not come. I want to be happy now. I want to be fulfilled now.
Yeah.
Not when I'm not in pain anymore,
Right.
So.
Yeah.
Well, and it's tough because like the person who's looking at you, like you said, Anna, like you look normal, right? Like you don't look like you're struggling in pain right now. Like you don't look like, and so that can be a very difficult thing for people to try and grasp is, okay, I get life's hard. Life's hard for me too. And you start comparing things, and we get into this like social media comparison type scenario. And then, you realize like, okay, well, from your point of view, I can imagine you realize like, okay, wait, they're not getting it. They don't understand. There's a different level of what I feel like. And I remember the first time you told me, Anna, that like, years ago, you were like, no, I deal with these things. And I was like, oh my gosh, I'm like, whatever I can do to help, like I'm here. And I remember you and I sat down with somebody else and we were like, okay, we're here for you. We can help you. Like, what do you need?
What do we need to do?
Like in not a fixing way, but like, how can we support you? Right. And I think that's a huge way to change your mindset. If you're somebody on the outside looking in, is okay. Well, just what support do you need? Like, I'm not trying to fix you. What support do you need? How can I help? We've sort of addressed that, like not all chronic pain is the same from a symptom standpoint. It's definitely not all the same from a root cause standpoint. Right. And I think that's probably the biggest, most frustrating thing for people to understand. Yeah. Is that it's different from where it started. It's different from the symptoms, but how you manage it as far as your life can be the same. Right.
Yeah. Yes. And I think it depends on the person. I know people that have full on fibromyalgia who can exercise every day.
Right.
They need to.
Yeah. I can't. Now I walk a little bit, but that's not easy for me. I mean, it's right now, especially it's very difficult. I do believe in moving, that movement is good for me. But I can't lift weights. I can't walk on a treadmill. I can't take long walks. I listened to one of your podcasts, and you had said something like that some of your advice that you give is just start with a 4-minute walk. Just walk for 4 minutes.
Right.
And then the next day or the next time you walk for 5 minutes. And that's kind of how I live, but I'll walk for 4 minutes and then I probably won't walk for 2 or 3 days. And then I'll go a little longer the next time. Right. But I don't do it in an exercising manner. I do it in I'm just moving my body.
Right.
Even when I'm getting from my car to my chiropractor appointment, that's a nice jaunt of a walk. And I have to walk up a flight of stairs and I'm like, and I don't do stairs well, but I'm like, you know what? I'm moving. I'm going to hurt even if I don't do this. So there's my exercise for the day.
Right. Right.
So anyway, I kind of went off there, but
you're good.
Yeah.
So I was, so she's had chronic pain her whole life. So she doesn't have a life before chronic pain that she remembers. And there's issues with that. And I don't want to speak for you, but if if a chronic pain journey starts in the middle of your life or in your 20s or whenever, you have a life that you remember and a life that you've had to give up.
Yeah.
And then have to somehow accept the new life that you have. And we had a follower comment on one of our posts that talked about having to give up your life. Right. And we are grieving the life we knew and grieving what we could have been if we didn't have pain. And one of the things that she said is that she will not accept it. And that really, really hit me hard yesterday when I read that. And it makes me a little emotional because I remember feeling that way specifically. Yeah. I will not accept this. I grew up healthy eating, exercising. My mom was a juicer. I woke up with fresh orange juice and green juice. I was healthy before I got sick. I exercised. We used to do sweating with the oldies with my mother-in-law. I've done Tai Bo. I mean, I'm all the 80s and 90s, you know.
Right. Yeah.
So giving up your life and what you wanted it to look like brings about a level of grief that never goes away.
Yeah.
Yeah.
What I want to address at this moment is the acceptance of the new life. It's not easy. And I think it's a daily, regular thing. Like today, you know what? This is my life. I accept it. Tomorrow might be, I don't accept it because it means that I can't go do what my husband is doing because my body won't tolerate it.
Yeah.
And that brings a new level of grief in that moment. And so just addressing that she didn't want to accept, she will not accept it. And she's angry and depressed.
Yeah.
And more than likely, she feels alone as well.
Right.
We don't want people to feel alone. I don't want to feel alone.
So what I would say to that is, like since I didn't have a life before chronic pain, this has just been my life. But I would see friends or, now that I'm a mom, I've got 3 kids. And I see other moms and they're like going to parks and they're doing all the stuff. And I grieve for my kids and I grieve for my personality is that I would go and do and have all the hobbies and do all the things, but my body won't allow for that. And so I will grieve for that. But where I've had the shift and the quote unquote acceptance is not so much just saying, well, okay, this is my life. It's like, okay, I can't run and play chase with my kids.
Right.
But what can I do?
Yeah.
I can engage with them and sit down and do a puzzle, or we can color or
snuggle.
I can sit down and I can talk to them. And that's been a big part of this whole thing for me and I've had to, I figured out how to deal with myself, but now having kids, it's like a new level of grieving and then acceptance and going through that whole process again. And just, I constantly go back to what can I do today? Okay, maybe yesterday I could run and that was fine, but today I can't. But as a parent, I have to show up for them. So how can I do that today?
Yeah.
Not how do I want to, how can I?
Right.
My kids will know that they can sit and talk to me and I'm going to engage with them and, those kinds of things. It's yes, there's an acceptance of your physical limitations, but it's also, what can I do?
Right.
You end up creating a new life for yourself.
Yeah. And I've had multiple people as guests that when we're talking about health or how they've changed, their life to deal with whatever issue they've had, that it's a very common theme. And I think it's sort of what you're saying is that like you get to a point where you have to control what you can control. Right? Like you can't
because everything else goes out of control.
You can't control all those other things. Like and so like you can't control if you're going to wake up and be in the worst pain you've ever been in your life, or you're going to wake up and it's going to be a good day. Like you might not be able to control that, but once you wake up, what's in your control? what can I do? Right. And I think comparison becomes a big piece of that, because like when you're talking about your kids, like if you look at it and go like, oh, I can't do what that parent's doing with their kid, or I can't do that, you can go very quickly down a rabbit hole of depression of like, oh, I'm no good as a parent, I'm no good as a da 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 da. Versus the other side of it is like, okay, well, I can't do those things, but I can control how I interact with them. I can control the love that they feel. I can control all these things that they're still going to remember.
Absolutely.
So, and I'd like to address that, because I was one kind of parent, and then my life changed, and I had to become a different kind of parent. And that was very brutal. But I did learn something, and I'm going to address my daughter, because I don't think I've ever said this exactly to her. But you are the mom your kids are supposed to have.
Yeah.
And the things that you're teaching them in your pain journey is what they need for their character and their life and what they're learning.
Yeah.
They're not going to be damaged by your lack of not being able to do these things. And what Jerry was saying, in comparison to other moms or other situations, you, Vivian, are the right parent for your children.
Yeah.
And they will only benefit from it. And I think that that ministry and that gift of presence is more important than anything.
Yeah.
Just being there. And if I don't know, every Mother's Day, Vivian would, when she was younger, would write me a little card, and she would always say, thank you for always being there for me. Thank you for always being there. And I'm like, okay, that, if I can't do anything else, then I know I can be there for them. And that is so important. So important.
Yeah. Well, I think that's a really good summary of like the whole conversation. And like, that's what you're looking for if you're in chronic pain, is just somebody to be there. Right. Because you've come to a realization at some point during the journey, or you will come to an acceptance and a realization that like, okay, there's not going to be a quick fix. There's not going to be just a wake up and an amazing healing. Do we pray for it? Sure, of course. But reality is, I'm going to wake up tomorrow and I'm going to have some sort of pain going on. And so what I'm looking for is somebody to just be there on my journey with me and understand and help support me as a person, not me as someone in pain.
Yeah. Yeah. That's really, really simple.
It's good.
Yeah.
Good, Jerry.
So I want to thank you both for being on. How can people who are dealing with pain or want to learn more, or even the person who's like, my spouse is in pain and won't accept it, but how can I come alongside? Like, how can they hear your stuff, connect with you, find out more, all that stuff?
So we're on several social media. Sorry, my brain.
Right. It's okay.
It's part of fibro. It's like you can tell my brain skips every once in a while, and it's like I've got to reboot. Anyway,
we're on like all the social medias, so
TikTok, Instagram, Facebook,
YouTube.
Okay. Our podcasts are YouTube, Spotify, Apple, Google, and it's The Pain Project. On Instagram, it's thepainproject.co.
Okay.
And our email, if anybody wanted to actually reach out, is hello@thepainproject.co.
Awesome.
So, and our podcast, we have one, and it has a little bit more of the details of the story as to why we started this. And then we'll have another podcast coming out on Monday this next week.
Awesome. Well, yeah, and I know y'all are early, and that's why I wanted to get you on and just try and help you get word out.
Thank you so much.
So that people, because I think it's something that not only is it something that you're dealing with, and there's that whole like the physical piece of like what I have to deal with every day, but when you've got the emotional and mental side of what society is telling you should be able to do, or no pain, no gain, all those kinds of things that you're just like, oh, these things are so stupid. Just like, can we just normalize it and help people? And so hopefully we can do that.
Yeah. And I just want to say, Jerry, I've known you for a long time. I want to say like at least 8 years, 7 years.
Oh, yeah. At least something like that. Yeah.
And so, just we've talked off and on, and our last conversation was actually very good for me. And so I just want to say thank you to that. And I want to thank you also for what you're doing, because just a couple of podcasts that I've listened to that you're doing, you're doing a great job.
Oh, thank you.
I just want to say well done and thank you for what you're doing. And I hope people subscribe and listen and pay attention. And I love you're all in. You're all in.
Yep.
Health and wellness, and I'm super proud of what you're accomplishing as well.
Oh, thank you so much. Well, it was a pleasure having you on. And yeah, I'll link all those things in the show notes so people can connect to you very quickly and easily. And praying for you as you continue this journey, that you're able to help and reach out to people and help them along their journeys.
Thank you.
Thank you, Jerry.